The World Health Organization says frontline health workers and the youth are most affected by suicidal thoughts. Furthermore, it says COVID-19 caused a 28% increase in depression rates and a 26% increase in anxiety disorders within the first year of the pandemic. This comes as the global community marks Mental Health Awareness Day. Earlier, Professor Ramneek Ahluwalia, a medical expert, spoke to SABC News about the significance of raising mental health awareness.
The biggest pandemic in the world is mental health. 1 billion people in the world are diagnosed with mental health. These are diagnosable mental health conditions. And that's the magnitude we are talking about. In South Africa, we see 16.5% of the entire population, as per our WHO 2020 report, that 16.5%, which is a huge population, that is suffering from mental health. 1 in 5 youth in South Africa suffers from mental health. So every 5th young person is at very high risk to mental health condition. 4% of our youth have severe mental health disorders. And these are the things that we are trying to bring together. So this is real. This is in front of us. Stigma makes it far more worse. 75% of all the cases of mental health start before the age of 24, which means the onset of this mental health disease is a young person's disease. In fact, 50% even start before the age of 15, so which is at the high school level rate. So obviously, universities, schools, young people, and the focus for today, from my perspective, has been it's a real disease. It's around us. Yes, COVID has just brought it into reality, but it always existed. We need to break the stigma of this disease. And young people are extremely vulnerable where the onset starts. And I think we need to bring awareness and education far more earlier now in order for us to overcome this pandemic if we have to and we want to.
Yeah, it is fascinating. I mean, I've heard, let's sort of take it back to being a child now, because if we perhaps intervene earlier, it may help. I mean, I've heard children as, I don't even want to guess an age. You can tell me the ages of perhaps the youngest case that you've seen, but I certainly have seen very young children that have been diagnosed with some form of a mental illness or depression. And this is where you worry, because you think that, children are okay, they fine, don't worry about the kids, they're happy. But it doesn't seem to be the case. So let's start from those very early formative years. What should we look out for in children if they are in fact going through depression? What is leading them to suffer from depression? And why is it getting younger and younger?
So definitely many reasons, one is genetic. Mental health is also a genetic disorder in the sense that it is that if your parents are prone to, or if you're genetically prone to, mental health does manifest at a very early stages. But the other bigger issues are acquired issues, So when you have a genetic predisposition to mental health, the acquired stressors, and let's talk about South Africa now with the acquired stressors. South Africa is a young country, which is 27 years old, a country which has inherited a very difficult past. Most of our young people are born of single parents. They've seen abuse right from the young ages when they're growing up. That's a reality. Financial distress in the families, trauma and abuse around, which brings a young person's development at a very young age with an acquired stresses around him or her, which builds from the very young age what we call it as a psychological distress around him or herself when the child is growing. Comes to phases of growth, enters into high school, and specifically when it flares up, which is after the age of 17, 18, as what the data suggests, is when you leave your guardian control or parental control into a new world, academic stresses, financial distresses. These are all phenomenons that are around us as society, as a reality of South Africa. And that's why mental health in young people becomes far more severe and far more early onsets for us to now start diagnosing. Symptoms are very clear. Very little attention to detail. You see the child, usually the first start symptoms are when the attentions are not there in the academic classes, your results or marks are coming down, you start seeing the child isolating him or herself, you see difficulties in sleeping, eating challenges where the child is either not eating or eating too much. So these are a lot of factors one has to observe as a parent when you are, or a guardian, when you are around young people, so that at that moment, because the problem with mental health is not being diagnosed. If 70% of South Africans go undiagnosed in mental health, specifically in the young ages, 80% in underdeveloped countries, 50% even in developed countries. So the biggest challenge is diagnosing mental health. A lot of people themselves feel they will fix it themselves, which is very difficult or possibly impossible. And any disease, Leanne, whether it's COVID, whether it's blood pressure, whether it's diabetes, whether it's cancer, if found at a later stage, it's very challenging to get it back because it becomes almost irreplaceable. The best way is to diagnose everything early, and mental health is no different.